Good morning, everybody. It's Felisa. It is a beautiful day in my neighborhood. It is gray, about 32 degrees. No sun today, but hey, it's January. Anyway, this is going to be a podcast, and I wanted to come and touch very gently on mental illness and substance abuse. And I say gently because, I want to give this disclaimer. These are my ideas, my thoughts, my observations, and many times these are my experiences. I am not a mental health care professional, nor am I a substance abuse professional, but I do have my own personal experience with mental illness and substance abuse, and this is my opinion. So, the majority of people have seen the video upload of Delonte West, number one being beaten in the street, and then number two being interrogated on the side of the road by a police officer. Maybe I shouldn't say interrogated, but questioned on the side of the road by a police officer. It's very clear that he is not oriented times three, and that, he's very agitated, he's disheveled. Clearly there's something going on with him, and I couldn't even really watch that video. And this is not the first time that Delonte has been in the press, and I want to make sure that I'm very clear. I don't want to act like I'm some sports enthusiast and I immediately placed him and knew exactly who he was. I knew the name, and I had to do a little bit of digging because I wasn't immediately, it didn't immediately click who this person was. So I knew that he was involved in sports, but if you had asked me who did he play for? What did he play? I would have really had no idea at that particular time. All I knew though is that was somebody's son, and he was struggling. And that's something that my grandmother used to say all the time. And, my mother said it, and now I say it. I think it was just a way to remain compassionate. But my grandmother, when she saw people who were struggling, and I'll just say that, she would always say, Lord Jesus, that's someone's child. And I think that every time I see someone like Delonte, Lord, that is someone's child. That's someone's son. That's someone's daughter. My God, how did we wind up here? It just breaks my heart. It really, really does, because the society that we've devolved in today is more interested in taking pictures and videos and uploading someone at their worst possible, lowest moment and capitalizing off of it. This internet culture is horrible in terms of empathy and human relation. But I digress. So, the pictures of Delonte were actually very similar in feel, and got the same response from me when people were taking pictures of Whitney at walking around ATL and looking a hot and complete mess, or pictures of Maya Campbell walking around wherever she is looking a hot and complete mess, taking videos of them clearly either high or in the middle of a psychotic episode, and or I should say psychiatric, not psychotic, psychiatric episode, and not really, really in touch and connected to what's going on around them. And I just find those kind of people who do that just reprehensible. It's all for clicks, likes, shares, and money, and it's absolutely ridiculous. But back to the mental health. So I see a lot of calls for Delonte's team members to assist, and particularly LeBron James. I saw the same thing with Whitney. As a matter of fact, I just saw a meme the other day about Whitney Houston, and the person that posted it was saying nobody helped her, and her family should have helped her, and done this, that, and the third, and she just was left out there to dry. Okay, so, and I did comment on the post. Here's the thing, and here's where it gets extremely personal for me. I lived with someone who was an addict. He was a raging alcoholic, went on binges. I think I've talked about this before. And would stay gone 2-3 days, leave me in the house house with no car, no resources, with children, stole money from his kids, stole money from me. Yes, it's possible for husbands to steal money from their wives when they don't work. And generally was a nightmare to live with. And I want to be clear, this is not a malicious account, or I'm not saying it to tear him down or to tear black men down. No, it just was like, this was my experience. And when I tell you the amount of stress and trauma and day-to-day anxiety that came out of that, there's no way that you can control another human being. You can't force another human being to do a doggone thing that they don't want to do. Has anybody ever watched Intervention? I mean, you could have all the professionals available, you could have all the resources lined up. That person has to decide that they want the help, that they want to get better, that they want to do the work, because you can't magically do that for them. You can, all the parameters, all the boundaries, that's nice, God bless you. But I'm telling you, when you live that, when you are walking on eggshells, where you have no idea what the day will bring, you have no idea if your loved one will come home sober, or if they will come home high, or if they will come home at all. And then you spend the rest of the night looking for them in hospitals and jails, and calling friends and carrying on, and they come in 2 and 3 days later like ain't nothing happening. Do you understand the stress and the strain that is involved with that? You can't prevent someone from living on the streets if that's what they want to do. Whitney Houston was ridiculously wealthy. Delonte West, from what I understand, earned about $16-17 million before he left the NBA. Maya had a career that would have probably gone the distance. The woman was beautiful, breathtakingly beautiful. And let's not forget that Bebe Moore Campbell, before she died, was desperately looking for help for her daughter. I remember interviews that she would give, and Maya's name would come up, and she would just look so forlorn and sad, because this was her child, and she had no idea at that time where she was. And if she did, she realized that Maya was not in a good place. And so, she tried to wrap arms around her, tried to, give resources. At some point, families have got to be able to save themselves. They do. They have to be able to walk away. They have to be able to know that they've done everything that they possibly can do in order to save their loved ones. How many times have we seen where there is someone with a mental health issue who is spiraling, homicidal, a danger to himself or other people, and the family has no choice but to call the police. The police get there, and the police have no idea what to do, and that person is shot and killed. I'm not even blaming the police. You cannot understand the level of chaos and frustration and upset that a family would go through to even have to do that. You just don't know. When they are in the middle of an episode where you no longer can contain them. And trust me when I say that the last thing that a family wants to do is to call the doggone police. Like, we want to be able to handle whatever it is in the confines of our home and not have our loved ones be involved in the system, quote unquote. But there comes a time when you can no longer physically, emotionally, or spiritually do battle with that person, and you've got to call in reinforcement. And I think that, when families reach that point, they are at a breaking point. They really are. And this unfair judgment and opinion from people who don't live it, who've never gone through it, who don't understand the limitations of the resources that we have. If you look for stories of anyone who has had to navigate the mental health system, there are no resources. I worked mental health and inpatient psychiatry, outpatient substance abuse for 3 years in one of our local hospitals. During that time, our governor decided that they were going to close all of the state community mental health agencies. Close them. In a city like the city that I lived in, it was a major city, big city, primarily poor and African American. there were no resources, none. You close the state agencies. Private agencies are overwhelmed, overloaded. A lot of these people did not have insurance, or they had Medicaid. This was back in the early 90s, but they had Medicaid. So these private community mental health, they weren't even community mental health, these private mental health agencies were not taking Medicaid because it doesn't pay anything. And they definitely were not getting ready to treat these people for free. So what happened? They went off their meds. A lot of them were destabilized, became homeless, wandering the streets. No help, no resources, locked in their own mental health battles. Those patients who were dually diagnosed, meaning that they had a substance abuse issue as well as a mental health issue, quickly relapsed because the only thing that was keeping the demons at bay was the medication that they were able to get. So without that medication, here came the voices, here came the delusions, here came the manic state, or the depressive state, or the anxiety state, or the struggles within themselves. Things that we had worked so hard to help these patients deal with was gone. The safety net was just gone. And we have never recovered. Our city has never recovered from that. Our state has never recovered from that. And so, it's just amazing to me when I see people who are so short-sighted and so limited and myopic in their view when they talk about mental health issues, that it's all about, the families need to do this, or anybody needs to do that, not realizing the difficulty of navigating that whole system. And then again, this tendency to just treat someone like a circus animal, like a zoo pet, just taking pictures and uploading it. Like, that is just such disgusting behavior. And I'm so upset right now and so triggered, because these people need help. They need help. They really do. They have no idea what's going on around them. And, it's very common that they become a danger to themselves or a danger to other people. And it's only at that point that society even reacts or cares, because, they're out on the street and possibly could harm someone. I think I did a story time. There was a time when I was a little girl and I was walking to the store, and this man just popped out of nowhere. He had been walking down the street yelling and screaming. He had a huge knife that, to me at that time, because I was little, looked like a machete. It probably was a butcher knife, but still, he had a weapon, and he was throwing it into trees. And I remember, waiting. At least I had the good God-given sense then, okay, yeah, girl, you better not go out there, because this man is scary. So I thought that he was gone, decided I was going to walk to the store. This man jumps out between two houses, beats me mercilessly on the street. Nobody helped. Nobody came. Nobody, rescued the little girl. I think I must have been about 10, maybe 11, sent me running home, in fear for my life. I've never forgotten that, and I don't really hold anything against that guy. I really don't. It was a scary, scary time in my life. I still have residual issues from it, just the trauma of it all. But that man in of himself, I know that man either had to be high or mentally ill or both. That man was not in his right mind. I can't blame his family for that. I can't blame, his mother or whoever, he was around, his loved ones. Oh, they should have kept him off the street. Y'all know how hard it would be in order to corral a 200-pound man with man strength and make him stay in the house? Y'all think about that. Seriously, you just gonna block the door and he just gonna sit down. That's how that works. When he's tearing up your whole house and yelling and screaming and hollering and all kinds of other things and threatening you just gonna keep him in the house? That makes no sense. I need for people to think about what it is that they're saying and stop assuming that families have not reached out and tried to get help for their loved ones. I need for people to realize that someone's mental health journey and someone's recovery journey is individual. They need our support, yes. They need our encouragement, yes. They need us to hold them accountable, absolutely. But we cannot do the work for them at all, under no circumstances. That is not how that works. Anyway, that's my mini rant for the day. I hope that y'all are having a great day, and I will talk to y'all later on. Bye.